question. It looks like this health bill's going to pass in spite of what, bad provisions it's in. Is it possible later on in 2 years to revamp it and redo it and what have you with maybe a new set of Congress people? Can it be done? I mean, it looks like it's going.
Theoretically, yes. The fear is that just like with prescription drugs for Medicare, which was a mistake that Republicans made, and I voted against it. That was a mistake. Newt Gingrich calls it the beginning of the end of the Republican majority. Not just what we did, but how we did it. Because what we did was we added the largest entitlement increase since 1965, which was not a very conservative thing to do with prescription drugs for Medicare. But then Tom DeLay kept the vote open for 3.5 hours to change people over to pass it because he had guaranteed the pharmaceutical and insurance industry would pass it. And I use that as an example because the Democrats railed about it. Now they can run the tables, but did they take it away? Did they repeal it? No. No. So the problem is you give an entitlement benefit, it's hard to ever get it back. But I'll tell you this, Larry, because here's what I think. This thing is so unpopular and it's not getting better, it's getting worse for them in terms of unpopular. The government health care takeover, because everybody wants health care to improve. And I'll tell you another thing, because I'm pretty honest, I'm real honest about Republicans and Democrats having been active at every level of our party. I supported in 1998 what was called a patient bill of rights. Not many Republicans voted for it, but it passed the House and the Senate did not pass it in 1998. It reined in the health insurance companies. It guaranteed portability. It allowed pre-existing conditions to be covered, and it lifted the lifetime caps on benefits by reining in the insurance companies. Now, the health insurance companies didn't like it, and frankly, they really haven't supported me because of that. But had we done that, Larry, we wouldn't be here today debating this issue. The Democrats have used the fact that health insurance companies have rationed care as their excuse to let the government take it over, and both are wrong. Both are wrong. Health insurance companies shouldn't be able to ration care, and the government shouldn't take over our health care system. Both are lead to bad outcomes. But unfortunately, Republicans didn't let that go forward in the Senate, and as a result, they're now using that as an excuse. I believe this, though, because it's so unpopular, because they're so unpopular, I believe there's going to be a political tsunami next year, and the House is going to flip back. The Senate can't flip back because there's not but a third of them up for re-election, and it's 60-40 right now, and President Obama is going to serve one term. But between 10 and 12, political power is going to swing back completely the other way in 2 election cycles. And I believe whoever runs for president in our party is going to be able to say, I will be elected president and we will go back to a private fee-for-service healthcare system, because people are not going to be satisfied. Remember TennCare, when it was implemented, how difficult it was for 5 years. We're about to see that nationwide. And you're going to see the ability for candidates to say, I will take this and put it back the way it was and make it better as a campaign issue. And you might actually see a political shift that says, no, we're going to move back away from a socialistic approach instead of this direction, because yesterday, the CMS that manages Medicare gave a report on the Senate health care bill, which the fear now is that they're not even going to conference the two. Whatever the Senate passes, they're going to send it right back to the House. The House Democrats will pass the Senate bill and it will be law. That's the fear. So you won't even have the ability to negotiate the differences. If they do that, CMS then yesterday came out with a report on the Senate bill and said health care costs to you and you and you and me will go up under this bill, not down. Well, his whole deal is we're trying to reduce the cost of health care. So now the cost of health care goes up, taxes go up, Medicare gets cut. I mean, what all do you need to know that this is not the right thing to do? Because literally they're taking $500 billion out of Medicare to do it. They're dumping all these people on Medicaid, which is TennCare in our state. Governor Bredesen is leading the charge against it because we don't have the money to pay for it. And now they're saying that the cost of health care is actually going to go up. I mean, this now becomes insanity to do it.
It's just one more thing that's added to the whole pile of things that's been happening.